All right. Good evening, everyone. Thank you for joining us for the webinar tonight of Rural Calling, Navigating Loan Repayment and J1 Visa Incentive Programs with 3RNet. I'll give everyone a minute to log on and join us. In the meantime, I wanted to introduce myself. I'm Rainey McNeely. I'm the Physician Engagement Specialist here at Practice Match. If you attend any of our live career fairs this year, you'll definitely meet me. Or if you submit any of your CVs for review, that all comes from me. I wanted to remind everyone about the free career resources that Practice Match can offer you on our website, and they're for during and after your career journey. I did want to remind everyone that your microphones are muted tonight. If you have any questions, please make sure you put them in the Q&A chat box, and we will get them answered during the event. Again, this webinar is going to be recorded tonight, and I'll be able to send the link to you to your emails that you registered for the event with by the end of the week. Again, your microphones are muted, so make sure you put your questions in the Q&A chat box. All right. Mandy, if you're ready, you can go ahead and present.
All right, thank you so much for having us today. We are thrilled to be meeting with all of you. It's my pleasure to share a little bit of information about 3RNet, as well as introduce you to myself. My name is Mandy Gingras. I am the Director of Education with 3RNet. I have been working in a nonprofit recruitment kind of capacity and education capacity for almost 20 years. It feels like a short time, but it sounds like a long time. But I am pleased to kind of bring some of my expertise and share some of the work that I have done over a number of years in recruiting and helping to recruit physicians, advanced practitioners, dentists, and other healthcare professionals to rural and underserved communities across the nation. I've worked in a number of states, and with 3RNet, the great thing about us is we are nationwide. We have a presence in every single state. I also wanted to let you know that I have a colleague on the line with us as well. Christine Morin is our Director of Marketing, and she is going to be helping me kind of navigate through the chat. So if you do have any questions, please put that in the Q&A and know that Christine will be responding to those. And if there's something with any of the slides or information that I've shared today that you have questions on, she will do her best to kind of interject and let me know if there's a question from any of you that I can answer specifically, or you can follow up with us afterwards as well. And we will make sure that all of our slides from today, I'm going to share a lot of resources with you all, a lot of really good information. So we'll make sure that you do get copies of all of the slides so that you have all of the information and resources right at your fingertips. So those of you that are not familiar with the 3RNet, the 3 R's in our name stands for Rural Recruitment and Retention Network. We are a nonprofit, federally funded organization, and our mission is to help improve rural and underserved communities access to quality healthcare through the recruitment of physicians, through recruitment of dentists, advanced practitioners, behavioral health specialists, pretty much all healthcare professionals across all different types of safety net facilities. We put out a job board, a nonprofit job board, to help all of our safety net facilities be able to reach great candidates like yourselves, and to be able to put all of their job opportunities up on the job board, so that it increases their exposure, to help them find practitioners, clinicians for their rural and their underserved locations. We also provide a lot of resources around helping candidates find job opportunities that are eligible for incentive programs like the federal and state loan repayment programs, for visa sponsorship, for the jobs that are eligible for J1 waivers. We also put out a lot of other job search tools to help you as you navigate your job search. I'm going to be talking about a lot of the guides that we have available to kind of help you navigate loan repayment programs, navigating visa sponsorship, and how to connect with all of our members and our network coordinators. So we have, I mentioned we were also, I think I mentioned that we're also a member association. So we have one member that represents every single state across the US. We also have a couple of extra members, such as the Indian Health Services. We also have Veteran Affairs as a member. The Cherokee Nation is a member. So all in all, we have 54 member organizations that represent their jobs on the job board. And like I said, the mission of our organization is to create awareness about jobs in rural and underserved locations all across the country. And we represent and support a number of what we refer to as safety net healthcare facilities. We also put together a guide to help candidates and clinicians really understand the different types of safety net healthcare facilities. These include federally qualified health centers, critical access hospitals, community hospitals, rural health clinics, Indian Health Service facilities or tribal health facilities, also Veteran Affairs, organizations like public health dental clinics, community mental health centers, or even substance abuse treatment facilities. The list goes on and on. But like I said, we have a guide to kind of walk you through the differences of these types of organizations to help you kind of better understand and to help inform you so that as you're looking through the different job opportunities available on our website, you have a good understanding of the different types of facilities that we represent. This is actually a quick snapshot of what our job board looks like. So I mentioned that we have a network coordinator in every single state. This is our Nevada page, and this is our network coordinator, Alexis Kirby, who represents our member in Nevada. So she works with the State Office of Rural Health. Our members are usually or are always a nonprofit organization that represents a large healthcare kind of facilities or group within a state. So for instance, State Offices of Rural Health, primary care associations or primary care offices are our members. We also have, like I mentioned, the VA and Indian Health Services would also be a type of member that we have. But anyway, so this snapshot just kind of shows you what the website looks like and how to kind of navigate throughout the website. For any of you that maybe not have been to our website, but it's 3rnet.org, and you can literally do really fine tune or refine your search wherever you might be interested in looking for a job. This is what the job board looks like once you actually start looking for positions. You can refine or filter your search by loan repayment eligible opportunities or J1 visa eligible opportunities. We even have a filter for telehealth, or if you're interested in faculty or teaching positions, or if you're just out of training and looking for opportunities that are open to accepting new grads, we have that available as well. And you can also search by HPSA scores. And I'm going to talk a little bit in a few minutes about what HPSA scores are, and just kind of give you a couple of tips on navigating HPSA scores and important things to know. But again, just wanted to give you kind of a snapshot of what the job board looks like and how to navigate that. But right up here in the upper right-hand corner where it says for professionals and for employers, those are the two pages that you can toggle back and forth. But for professionals is where you would want to go to register to be able to kind of view the jobs that are available on the website. You can download your CV and just kind of peruse around the website to really see all of the different resources and job opportunities that we make available on the website. This is just, again, another snapshot of the website where you can utilize different aspects of our job board, from signing up to receive email notifications or job alerts when new jobs get posted that might match your criteria or your preferences. So you can go into your profile and really kind of fine tune your job search to match whatever preferences you might have. You can also find information on our list of contact people for each state. So you can access the contact information for our network coordinators. And like I said, you can save your resume and also favorite some of the jobs to your profile so that you can refer to them at a later time as well. I'm going to be talking a lot about these resources here. These are what we call our 3RNet guides. We have a number of these available to kind of help you navigate your job search, whether you are interested in opportunities that qualify for loan repayment programs. Maybe you are an international medical graduate and you are looking for opportunities that are eligible for J1 visa waivers. We have a guide to help you kind of navigate that a J1 waiver job search and things to important things to know, timelines to be aware of, which we'll cover tonight. Also, we have a guide to kind of help you navigate health professional shortage areas and to really understand how those shortage areas are designated and what that might look like across different states. And I also had mentioned that Safety Net Healthcare Facility Guide. We have that one there. These are all free resources available on our website. You can access them from the link here, or you can go to our website and find them on that page as well. These are a couple of new resource guides that I'm really excited to share with you. First of all, this first one we're going to be talking a little bit about in a few more minutes. This is the benefits to living and practicing in rural communities. And this is really a guide to kind of help you determine if a rural lifestyle is ideal for you and to kind of understand all of the different nuances that living and practicing in a rural community, what that might look like, so that it helps you kind of better understand if that's the type of work that you are passionate about and cut out and and it would be an ideal fit for yourself. We also have the Healthcare Career Compass, just gives you some more tips and tools to help you kind of navigate the job search. So I encourage you to check both of those out, and I'll be talking a little bit more about those in a few minutes. So to start us off tonight, some of the things that I wanted to share with you from our the benefits of rural living and practicing guide were just really some of the from my experience of working with different candidates and also talking with all of our physician ambassadors that have found their forever jobs in rural locations all across the country, just interviewing with them and learning from them of what drew them into a rural community, what keeps them there, what they kind of the takeaways and the things that they're really passionate about. And things that we have heard is it's really hard to beat the lifestyle that rural communities have to offer, from the lower cost of living to being able to reduce your debt through loan repayment programs and other incentives. Um, to also the shorter commutes and the amount of time that one can save by not having long commutes that you might see in a more metropolitan area speaks volumes. And time is money nowadays, and that is something that a lot of people that practice in rural communities, they say that that's one of the top perks. They can have less burnout. They can have more time with their families when they're shaving off 1 to 2 hours every single day on commute time. And that gives them back, 1 to 2 more hours of time that they can spend with their families or just to have a better work-life balance. There's a lot of abundant recreational opportunities in rural communities. I think that's something that we see across the board, all across the nation. Different areas offer different types of recreation, but usually in a rural or outside the outskirts of a metropolitan area, there's a lot of, especially if you love the outdoors, there's a lot of opportunities for you. But not just the lifestyle improvements, there's a huge amount of community impact that healthcare professionals find from practicing in rural communities. And professional development is something that we hear is a great perk as well. Um, from when you are working for a rural or an underserved community, um, you're addressing those health disparities, and you're giving back to medicine, which I think that majority of physicians, majority of healthcare professionals, they pursue medicine because they want to take care of others, and it's that um, passion for medicine that really draws them um, into the field. And I think that in a rural community, you can see that impact so much quicker, and you can really see the impact that you're having on a particular community, a lot of times much easier than you might be able to see in a more metropolitan or a more urban area. You're able to really build some strong relationships with your patients, and you become such an important part of the community, which all leads to a better connection to your profession and leads to better fulfillment and job satisfaction as well. A lot of times in a rural community, you can progress in your career a lot faster, because a lot of times you have to develop a very diverse skill set. You have much broader responsibilities when you're working in a smaller facility. A lot of times you'll have a lot more autonomy in making decisions about the practice. And a lot of times leadership opportunities can come up much quicker when you're working for smaller organizations in rural communities. And you can also be involved in the community, in the greater sense of your community, at a much deeper level in smaller communities as well. There is awesome community support. If you've ever lived in a rural community, you have that tight-knit kind of sense of family type of a work environment, which leads to really great team collaboration, some really great camaraderie and friendships in your work, and some awesome mentorship opportunities as well. And we find that working in underserved communities really brings about such a great sense of pride in and really holds a lot of clout in your healthcare professional reputation amongst the broader medical community. So if you want to really kind of tap into some of those benefits and learn more about the benefits of living and practicing in rural communities, I really encourage you to check out the guide that we put together, and share. And I'll share also in the slides some more stories that we have on our website about other healthcare professionals who have found their first, next, or forever job in a rural location. So I'll share more on that in a few minutes. So I kind of want to switch gears and talk a little bit about navigating the loan repayment programs, because I know a lot of you on the call are interested in finding opportunities that are eligible for loan repayment. So I wanted to be able to point you to some really helpful information and some resources to help you kind of understand and navigate through the many different incentive program options that are available to you. Many of you are probably very familiar with National Health Service Corps programs. There's also those would include the National Health Service Corps loan repayment programs, also the student to service programs, and there are also the National Health Service Corps scholarship programs. Also included that are Nurse Corps programs, and with as well as loan repayment and scholarship. There are also state loan repayment programs available. And then there's also independent state loan repayment programs, and other programs such as the Public Service Loan Forgiveness Program. Or you might even have opportunities for either community-based or hospital-based loan repayment programs. I have a link here on the slide to it. We have a loan repayment program assessment tool, which is really helpful if you are interested in any of these types of incentive programs. It's a great way for you to kind of understand what are the important questions that you should be asking about the programs when you're exploring all of these different types of options available to you. Really important to know the advantages of the programs, and to be able to assess if the programs are the right fit for you, and really look at some of the risks that might be involved with the different types of programs too. So understanding what the eligible requirements is really important. Understanding the service commitment that is attached to each one of these is also important. So knowing how long you would be obligated for each one of the different programs. Understanding what the HPSA score is for the different eligibility for these programs and what types of sites or facilities would be eligible for the different programs. Also, your repayment obligations. And if there are any penalties, if you're unable to fulfill your service commitment or service obligation, that is all really important information that you want to make sure you know ahead of time before you commit to any of these programs. Also, obviously knowing what the the incentives are, the amount of money or the financial incentive that you're going to be receiving through the program. That's important to know. Knowing about what the different application requirements are going to be, if there are any applicable ones, and if they are going to apply. Same thing goes for tax liabilities for any of these different types of programs. Making sure that you know what those are and if they pertain, if the different tax laws are going to pertain to those types of programs. So again, lots of different nuances. We only have an hour today, so I don't have enough time to go into all of those, but those are all really important things to understand. And those are some of the things that we cover in our guides to help you kind of navigate through those programs. One thing I did want to share with you is understanding what the HPSA designation is. So HPSA stands for Health Professional Shortage Area. It is a federal designation. A lot of the loan repayment programs are, they prioritize award recipients by HPSA designation or even a HPSA score. HPSA it's a type of a rating system that is used to determine the highest areas of need for different healthcare providers. There's one facility in every state, which is the primary care office, that determines, or they collect the data that determines those federal HPSA designations. I did provide a link here on the slide of where you can find, there is a PCO in every single state that compiles that information. So if you have questions about HPSAs or want to know where you can find a HPSA map for any particular state that you might be interested in practicing in, there are shortage designations and maps to help you kind of navigate through that. And a couple of important things to know about HPSA scores is the HPSA score is not a permanent number. It can change over time. And the HPSA score usually ranges anywhere from 1 to 25. The higher number indicates the greater the need. 1 to 25 is for primary care and mental health HPSA scores. Dental goes from 1 to 26. And then I have just a quick statistic at the bottom here that there are 99 million Americans that live in primary care health professional shortage areas nationwide, and more than 17,000 practitioners are needed to remove all of those HPSA designations. So just a fun fact to kind of put that into perspective. A couple of other important information or things to know about HPSAs. HPSAs are calculated using different methodologies, from low income to the physician to population ratios. There's also geographic factors that are taken into consideration. There are 4 different types of HPSAs. I mentioned mental health. There's a dental health professional shortage area. There's a primary care professional shortage area, and then there is a newer maternity care shortage or type of HPSA as well. And then there are also additional designations based on HPSA geographic location or a geographic high needs location. There are also population group HPSAs and a facility HPSA, such as a federally qualified health center, gets an automatic facility designation for being in a HPSA area. There's also something called a medically underserved area, which is referred to as an MUA, or a medical underserved population, which is MUP. And then I mentioned that maternity care target area as well. So there's a lot of things to kind of know and understand about the HPSAs. And again, those guides can kind of point you in the right direction of where you can kind of learn more about the different types of designations and how those are calculated. Some of the important things to know is those HPSA scores, like I mentioned, they can change. And HPSA scores are put into priority. The higher the score, the more competitive the awards get for particular organizations. So like loan repayment, scholarship programs, they all will use HPSA scores to determine their highest eligible areas for service. Organizations like the National Health Service Corps, but even some of the state loan repayment programs may utilize the HPSA scoring system as well. And I mentioned your PCO is a good contact to be able to reach out to find out in whatever particular state you might be searching for what the HPSA scoring will look like. This is a quick snapshot. If you are a National Health Service Corps scholar, that is the most competitive scoring that is utilized for the scholar positions. I don't have in that chart the 2025 scholar score requirements, but they are very similar. The primary care physician and nurse practitioner score for fiscal year 2025 is also a 19. The physician assistant actually has gone up. It went from a 3 in 2024. It's now a 5 for physician assistants. Certified nurse midwives has gone from a 7 to a 16, so it's a much higher score, which means it's a higher need area. Dentist is now, it has gone from a 19, which is a very high competitive score. It's gone down to a 3. So that's a significant change. And then for psychiatrists, that is now, it's also a 19, same score. So I just wanted to make sure I pointed those out to you. And then I've also included some links here to kind of help you navigate the different programs and find out some of those service requirements and eligibility criteria for each of the different types of loan repayment programs that are available through National Health Service Corps. And then this is just a quick snapshot of where you can go to learn more. You can always contact your PCO. You can go to there's 3 different websites here. You have data, HRSA.gov, you have HPSAfind.HRSA.gov, and then you also have the shortage area by address tool where you can go to find out a particular facility to find out what their HPSA score or their designation is. If you're looking at a particular practice or at a particular community, these tools will kind of point you in the right direction of finding out what those HPSA designations are for the different communities. You can also reach out to our 3RNet members in each state. They can be a great resource for helping you navigate through the different loan repayment programs, but also those HPSA designations in whatever state you might be interested in. And here's just a quick tool to help you reach all of those different organizations and to learn more about the different programs. So I want to switch gears. If we don't have any questions on loan repayment, I want to switch gears for the next half hour of our time to talk about J1 visa waivers and some of the processes around that. So I'm not seeing that we have any questions. Christine will let me know if any come up. Make sure you throw your questions in the Q&A if you want us to answer your questions. So first of all, I wanted to just kind of give you, there's a lot of really important, timely information to know about if you are an international medical graduate looking to work under a J1 visa waiver. There are several programs that and resources available that offer waivers for H1B work visas. You can access waivers through the Conrad 30 program. With the Conrad 30 program, each state is given 30 J1 waivers that they can use at their discretion in their state. Each state is, so there are, from the 30 waivers, 10 of those waivers are dedicated to what is called a flex spot. And I'll talk about that in a few more minutes. But a flex spot, the states have some discretion of how they want to use those particular waivers, those 10 waivers set aside for more specialized positions, for instance. And then the other 20 waivers are dedicated to primary care specialties. And each state can kind of set their own, based on what their specific needs are in their state, they can kind of change their how they use the waiver program in their state. And I'll share more information on that in a minute. Another program that offers waivers is the DHHS office. They have the HHS Exchange Visitor Program. And then there are several regional programs as well that offer waivers. There's the Appalachian Regional Commission that also referred to as the ARC program. There's also the Delta Regional Authority, which is the Delta, it's referred to as also Delta Doctors. There's the Southeast Crescent Regional Commission that is located in the southeastern states. And then there is one of the newer regional commissions is the Northern Border Regional Commission, and that is up on the East Coast in the northeastern coast that covers a number of states there. And I've included all of the different links. So if you are looking at J1 visa waivers and want to know about which states are covered under each of those different programs, you can refer to those links as well. Again, your primary care office, there's one in every single state. They are responsible for issuing the Conrad J1 waivers. They also do the HPSA designations at the state level, the primary care offices. And there, like I mentioned, there is a primary care office for every single state. And there is a link here where you can find a particular state's PCO office. We also have on our website J1 visa contacts for each state. We have that listed here under our members, where you can locate all of the different J1 visa contacts. So again, if you're interested in a particular state, you can learn who you can reach out to kind of address or answer any questions you might have in a particular state on how they manage their waiver programs. If you are curious about where the waiver slots get filled, so I mentioned that Conrad program offers 30 slots for each state to use in their states. So if you're curious about which states fill up, there are a number of states that actually fill very quickly. Once they open up the program in the application process in the fall, some of them fill within a couple of hours or a matter of days. It really does fluctuate. But I wanted to point out that 3RNet tracks all of this information. So this can be a really helpful tool or resource for you to refer to, especially if you are in a very competitive specialty, or if you are interested in an area and you want to a particular state and you want to find out how competitive J1 waivers are, how quickly they fill up in that state. And maybe you might be interested in finding other states that maybe have waivers left over, where you might be able to kind of plan your job search around that based on where there are openings available. We also collect data from each of the state offices to help them coordinate their Conrad 30 programs. So we have a report that shows trends. So you can kind of, and I'll show you that in a minute. I have a snapshot of that report. This is the actual report of data for FY 2024, the fiscal year. So there were a total of just over 1,000 J1 waivers. This is data on the Conrad program, the Conrad 30 programs. So there were a total of 1,010 waivers given out throughout the fiscal year, this FY 2024. 185 of those waivers went to primary care physicians, 19 went to psychiatrists, There were 777 specialists, so that would be under those flex spots. But again, states can use the waiver slots to their discretion of wherever their highest needs are in their states, and that fluctuates state by state. 238 of the waivers went to rural communities. 717 were in non-rural areas, but these were still federally designated areas. They were just more like an underserved facility, like an FQHC or rural health clinic that sponsors J1 waivers. And then there were 26 waivers that were split between rural and non-rural. And then there were 193 waivers that fell under that flex category, those 10 flex spots as well. So again, some really helpful information. Then you can really drill it down by state to see how many slots were filled and how many were remaining in each one of the states. This is some of the Conrad 30 trends. This is very hard to see, but I wanted to just kind of give you a snapshot. It is very, very small print. But overall, between 2001, when we first started tracking the data, and through 2024, overall, there were a total of almost 23,000 J1 slots filled. Fiscal year of 2020 was our highest year, where 26 states filled all 30 of their J1 slots. I think there were seven states here that filled all of their J1 slots in the last 10 years. So every year for the last 10 years, Connecticut, Indiana, Michigan, Minnesota, Missouri, New Mexico, and New York all filled all 30 of their slots consecutively. And then in FY24, 19 states had filled all 30 of their J1 slots. 4 states filled 5 or less of their J1 slots. We did have 8 states that had not yet, at the time of us putting this report together, they had not yet submitted their data. So there are, I just want to make sure I pointed out that there are 8 states that we don't have their data submitted into this report. And I mentioned that there were just over 1,000 waivers for 2024. So just to kind of show you some of those trends. As far as the J1 timelines on putting in your application and things to know about the job search process when you are acquiring a J1 waiver, you want to make sure, it's so important that you start your job search early. Ideally, that would be 12 to 18 months before when you potentially want to start working, which seems like a really long time, but there's a lot of things that need to happen within that time frame. So the earlier you can get started on your job search, the more successful and more likely that you may be able to obtain a J1 waiver. It's going to just really improve your results. You want to make sure that you're narrowing down where you want to focus your search, because there's a lot of states, a lot of different options and opportunities to really look at. So you really want to figure out what locations are your first top priority, so that you can start there, because you want to be able to also not only ideally locate the state where you want to practice, but also the type of eligible facility and where you see yourself being the best fit. One thing that we recommend is, as soon as you start interviewing with sites, or maybe even before the interviewing, when you're actually putting your application out there, to let the employers know that you are looking for visa sponsorship. You never want to waste your time or anyone else's time. And you just want to make sure that they understand what your goals are, what your requirements are, and you're upfront with that, just to speed up that process, so that they know that they're really under a time crunch to move things along pretty quickly. We also always recommend that you work with an immigration attorney to really kind of help you navigate all the different nuances that come with the employment process and navigating the waiver process. There's a lot of changing parts. There are no guarantees, and it's always very helpful when you have a professional that works with these types of work scenarios and employment processes on a day-to-day basis. It's so much helpful for you to really be working with someone that is very knowledgeable and can help keep you up to speed on the daily changes around immigration and immigration law. Make sure before you apply, you will definitely need to have a job offer from an employer before you can submit your application. So you have to have a job offer from an eligible employer who is going to be able to and has agreed to sponsor your J1 visa waiver, and then also your H1B work visa. And in some cases, you may be required to have a state license before you apply. Some states do allow you to, as long as you have submitted your application, you can still apply for your J1 waiver, but you have to show proof that you've at least started that process because that shows commitment that you are committing to the state and interested in locating or practicing in that state. As far as your responsibilities, you as the international medical graduate, you will be the one to apply for a case number from the U.S. Department of State, and then the healthcare facility or the employer site will be the one that will apply for your J1 waiver to the State Department of Health. Then the State Department of Health, which is different in each state, they are the ones that set the guidelines that you'll need to be able to meet to show that the specialty is one that's going to be enhancing coverage of for medically at-risk populations or designated area. And then the U.S. Department of State will be the one that reviews all of the J1 waivers, and that process takes about 4 to 6 weeks approximately. And then the U.S. Citizen and Immigration Services, they will review the J1 waiver application, and they will be the one to issue that final approval. That process can take anywhere from 2 to 6 weeks. So just to give you kind of an understanding of, that timeline and how long it can take to really work through that process. And then you also have to really understand and be prepared that you will be required to begin working within 90 days once you receive that approval from the U.S. Citizen and Immigration Services. Okay. Also really important to know are all of the different players in understanding what the visa process is. We've put together a really helpful guide with the tips that I'm sharing with you today, but also even more tips. There's a link to it here. You can also find it on our website. Some really important questions for you to know to ask when you're talking to whatever state you're interested in, to the primary care office. You want to be able to know where you can find the maps for their states. Some states have those maps readily available on their website where you can easily find them, others don't. So these are just a list of questions you might need to ask or might be helpful to ask. Also, understanding how the state might use their flex positions, what types of specialties they typically use those for, can be helpful to know. Understanding how they fill their slots, how quickly they fill their J1 waiver slots is helpful to know. Knowing if there are any state-specific requirements, especially along a different specialty or a different type of facility that might be eligible, that's going to be important to know. And if there's any state-specific application fees that might be applicable and what they're used for, that's going to be helpful for you to know as well. And then also if there are any other agencies in the state that offer waivers, for example, those regional commissions that I had talked about, or Department of Health and Human Services for primary care providers, or FQHCs are eligible for the DHHS waivers as well. And then there's a list of questions for you to ask the employer too. Really important to find out early on in the recruitment process who within the healthcare organization is going to be taking the lead on the immigration process. And then understanding how familiar they are with the J1 waivers and the process. Have they hired any other physicians through J1 waivers? How long ago was it? What attorney or immigration attorney do they work with that they've used in the past? That's going to be helpful to know. And then just getting a general sense or understanding of the culture of the organization or the employer is going to be helpful for you to know, are there other physicians who have received waivers that are working for their organization that you can network with and kind of reach out to and just helps you kind of work through and navigate the nuances and the processes for J1 waivers. And then also finding out from the employer if there's any type of assistance that they offer to help you to get you integrated into the practice and into the community. There's a lot of special considerations that hopefully employers go above and beyond to kind of help you get acclimated and get integrated into the practice and to help yourself and your families get established into the communities. Knowing all of that ahead of time is going to set you up for good retention within the organization. I also wanted to point out a few resources that we have available for you. We work very closely with many of the immigration attorneys that are available at Frederickson, and they have shared with us some really great guides that they've put together to help physicians navigate the different immigration processes. There's also a really helpful tool on immigration solutions for not only physicians, but also for their employers, which can be a really handy guide if you're working with a facility that maybe is not as experienced with working through that waiver process. So these tools and resources can be really helpful to kind of navigate all of the different options that are available to you. So there's links for all of those. We also have those on our website. And this again here is a snapshot of some of the different resources we have to help you as you navigate through the J1 visa waiver process. We have, as I mentioned, we have contacts in every single state to help navigate the J1 waiver process from a state level. We have the guides on navigating and understanding all of the different processes involved. We have all of the J1 slots filled by state. We also have those filters that you can put on your job search so that you can identify jobs that are eligible for J1 visa waivers. We also have the same for you to be able to, and some quick tools here on our website where you can search J1 visa jobs. You can also search for jobs that are eligible for loan repayment, as well as some of the other search criteria. So a couple of links to help you navigate through that. And then as we wrap up and kind of end our session for today, I mentioned earlier when we first started talking that we have stories about some really passionate mission-minded health professionals who have found really rewarding careers in rural communities nationwide or serving underserved populations all across the country. We call this our First Next Forever. And there are many stories, many great stories of different types of healthcare professionals who have really gone to some really wonderful areas from North Dakota to Pennsylvania. There's a story about one of our newer stories about Oregon, even in Ohio, and many, many more. I hope that you do get a chance to learn and hear from some of the physicians and how they were able to find their dream jobs in rural and underserved communities all across the country. And Dr. Shabiwala, Dr. Ramesh Shabiwala, he received a J1 visa waiver to practice at a community health center. I think it was a federally qualified community health center in Honesdale, Pennsylvania. And he has a great story on how he navigated that process and how our network coordinator helped him kind of fine tune his job search and find his practice in Pennsylvania. So make sure you check those out on our website. And last but not least, I wanted to make sure I left you with a lot of really great partner organizations that if you are looking to practice in the rural or underserved uh, kind of family of practices, these are really helpful resources for you to know about. These are all national organizations that represent rural and underserved communities nationwide. From the National Association of Community Health Centers, we have the National Association of Rural Health Clinics, the American Hospital Association, Rural Health Services. You have the National Rural Health Association, which is NRHA, the Federal Office of Rural Health Policy. There is the Association of Clinicians for the Underserved. They have a lot of great resources. If you are in oral health or you're a dentist, the National Network for Oral Health Access. There are primary care associations by state. There's one in every state that can be a really great resource. If you are in behavioral health or mental health, you have SAMHSA, which is the Substance Abuse Mental Health Services Administration, that offers unlimited resources. And you also have the National Association of Rural Mental Health. So just a quick snapshot of some organizations that are really great to know about, and we've provided the links so you can access their information. And then lastly, I have my contact information. Our website is here. We hope that you check out the resources that we have available, peruse through the different types of job opportunities, and please reach out to any one of us on the 3RNet staff. Please feel free to contact our network coordinators in any of the states that you might be interested in practicing in to learn more about the workforce development programs that they have going on in their different states. We would love to have you we would love to see you working and thriving in rural communities wherever your heart takes you. So we have a couple of minutes remaining in our time. I want to just pull up and see if there's any questions from anyone in the group.
Perfect. It looks like we have a question that says, can a specialist seek jobs in primary care or endocrinologists seek jobs in primary care? Will this affect a J1 waiver application?
That would be a good question for the individual state, for our members in the or a J1 context in the individual states. It really, so it the like I said, through the Conrad program, there are those 10 waiver slots that are dedicated to specialty opportunities or for specialists. So there is if a state can show a need for a particular area and there is an opening for, I believe you said it was endocrinology, that could be a possibility. The likelihood of a state reserving a primary care opening for endocrinologist, it's a state by state case. It would really depend. When I was working kind of in the field and looking at different waiver applications or applicants, it probably was not, it would not be something that we would ultimately prioritize just because we would be looking at a retention lens for that. And knowing that you have done your training in a specialized field might not make you, the best fit or best candidate for a primary care physician where you're not really going to be able to practice to your full scope of where you've done your training and really want to obviously concentrate your services. But again, it's a state by state scenario. So I would say looking at the 3RNet job board and searching for endocrinology positions that are eligible for a J1 waiver, that is your that would be my recommendation to you to go there, do that search, because there are endocrinology positions in some states that do that are eligible for J1 waivers.
And Mandy, I put the link to all the J1 officers in the chat for this person's question.
Perfect.
And I will also put in the chat for you, Mubarak. I apologize if I'm saying your name incorrectly. I'm going to put in a link to the job search Mandy was just mentioning. So that 3rnet.org/jobs, that's our physician. We have endo, diabetes, and metabolism all in as one specialty on 3rnet.org. But I have that, and then I have J1 visa eligible toggled on. So if you click that link, that will show you all of the jobs currently on 3rnet.org, which that job posting indicates they are open to visa sponsorship. And so if you want to see full job details, you can register or log in. Registering is free. You'll be able to save those jobs to your profile for free. And then if any new jobs are added that match your profile, like Mandy had mentioned earlier in her presentation, you'll get an email notification for those as well. But hopefully that helps you. Please put any other questions you may have in the chat or in the Q&A. Sorry. And I apologize. I had the chat open. I was watching it, and I must have an older version of Teams or something, because I went back to chat and then I came back to Q&A, and all of a sudden there are some things here. So I also saw, Mandy, there's someone who, Nile, if you're still on the presentation here, they have a question that seems pretty specific. I don't know anything about an H4 EAD. So this person is an IMG who's on a different visa, so not a J1 visa. They need help with an EB1 filing. And Mandy, I don't know if you're familiar with any of that. I am not. My recommendation to this individual was, because that's so person specific, case specific. I know just in all the years of working with the immigration attorneys at Frederickson, when it is so case specific, they always say ask an immigration attorney. So
Absolutely.
I don't know, Mandy, if you'd have anything else to. Okay, yeah, I apologize.
Have not. I know some of the nuances for the EB sponsorship, but not enough to answer specific questions on it. And it's been a number of years.
Sure.
Since
Yeah,
I've
we're
done
not
that.
attorneys. We're in no position to give legal advice. We can just point you to the right direction. So I hope that's helpful. Here's a really good question. Someone asked if they need to bring their own immigration attorney, even if the job they sign with provides them one.
You don't have to, but it doesn't hurt to kind of seek your own consultations as well, because it's very similar. I always compare it to, it's very similar as working with a real estate broker. And when you're buying a house, you have, the real estate realtor that represents the buyer, but you also have one that represents the seller. So that attorney relationship really kind of works. Facility attorney, especially if you don't have special circumstances, I guess, that would be very specific to your situation. If you have just kind of a general standard visa process that you're going to follow, you might not need that individual consultation. But if you have something very specific that's specific to your situation, that is a situation that I would say it's definitely in your best interest to kind of seek your own counsel, just to make sure that all of the I's are getting dotted, all the T's are getting crossed, and it's going to help, ensure that you're going to be successful getting your application through. Anything else that you saw, Christine? Unfortunately, I'm not seeing anything in the chat for questions.
I don't think so, but I'll maybe ask Rainey. I don't know if there's anything I've missed here, Rainey, that if you see, I apologize.
No, I don't see any more questions. Does
Cool.
anybody have any more questions? We can wait a minute or two to make sure nobody has anything. Okay. I am not seeing any more questions. So that will conclude our webinar tonight. Thank you so much, Mandy and Christine, for coming on with us. Like I mentioned to everyone, we did record this, so I'll be sharing that recording link with everyone by the end of the week. And it'll also be posted on our website, so you can go back and view it if you have any questions. And Mandy's information is also on the end of this PowerPoint, so you'll be able to see that on our website if you have anything else. All right. Thank you so much, everyone. Have a good
Thank
night.
you.
All right. Thank you, Rainey.